Hello, and welcome back to Mindfulness Voyage if you are returning or if you are new. I'm so glad you could be here and join us. Please do remember to like and subscribe to help others find this podcast. One of the things that is happening more and more in research around mindfulness is how mindfulness and psychedelics may complement each other and help people who are struggling in various ways. Today's guest will be talking a little bit more about some of that new research. Our guest today is Ben Lewis. Ben, thanks so much for being here and good to meet you.
Great to meet you, Ted. Thank you for the invitation and looking forward to our conversation.
I was so excited to see the paper, and we're going to get to that in a minute. But first, I'd like to give you a chance to just tell those who are tuning in a little bit about who you are and what it is you do.
Sure. Yeah, my name is Ben Lewis. I'm Associate Professor of Psychiatry at the Huntsman Mental Health Institute, which is at the University of Utah. I've been here in Utah since completing my residency in psychiatry and currently wear several different hats. I'm an inpatient adult psychiatrist, so I do clinical work with severe and persistent mental illnesses on the inpatient side of things. I am the director of our ketamine assisted psychotherapy clinic, which is relatively new. That's been around for a couple years now. And then I also am a clinical researcher focused on psychedelic assisted therapies, and in particular, very interested in this overlap of psychedelic interventions and mindfulness training and practice.
Yeah, great. Thank you for that. And as folks who have been listening to my podcast over the years knows, we've talked about psychedelics before with Roland Griffiths and with Catherine McLean. So I'm just eager to have a bit of an update because that's been a few years since we've done that. And really the paper I want to start with, and we may go into two of them, is your recent one about MBSR and psilocybin. So perhaps you could say a little bit of just how it came about, even wanting to do that particular research, and then what did you do and what did you find?
Yeah, sure thing. And like you mentioned, I mean, there is a precedent for this interest in the field. Roland Griffiths' work and Catherine McLean, you mentioned, and the folks at Johns Hopkins had run a study looking at serious spiritual practitioners and long-term meditators in conjunction with the psilocybin intervention. And certainly like a very robust history of this overlap and sort of the delivery of contemplative practices into the West and kind of early meditation teachers. So I think a lot of historical reasons for thinking that this overlap or this synergy or this combination might be interesting and might be useful, at least for some people, some of the time. I think my journey towards being interested in psychedelic assisted therapies really has been very related to just some of the big limitations I've felt as a clinician working in psychiatry and also some of the ways in which I had been engaging with the field, which had sort of over time not been working very well for me. And so this has really kind of offered a way of bringing more aspects of myself, and it has been a really exciting direction, and certainly very promising in terms of some of the early data on classic psychedelics and mood disorders and addiction. Some of the questions with psychedelic interventions relate to like how might we sustain benefits over time, oftentimes with interventions that are maybe just one or several treatments, and how best to maybe prepare people to maximize the kinds of experiences that are occasioned with psychedelics very commonly. So that's a lot of my interest in that combination of mindfulness practice and psychedelics. I've also mindfulness has been a really important thing for me personally, and so I have sort of vested personal interests there as well, and I think a lot of curiosity about the overlap in experiences that people can have from meditation alone or with psychedelics. So I think kind of many intersecting interests there.
So tell us about this particular study. What was the structure of it and what kinds of results did you get? I know you did some really good, interesting pre and post instruments we were talking about before starting recording.
Yeah, so Ted, the study you mentioned is still under review, so not published in a journal yet, but we have a preprint available. And this was a study looking at mindfulness-based stress reduction, MBSR, plus a group psilocybin intervention for healthcare providers dealing with depression and burnout. And this was a small trial. We ran this over the period of a couple years and fairly recently finished this and enrolled physicians and nurses that met a certain cutoff threshold for depression and met a, a threshold that we had for burnout using the Maslach burnout inventory as our primary tool. Um, and then we randomized participants to either just doing an 8-week MBSR course, which is run through our institution and 2 hours once a week over an 8-week period of time, or doing that same curriculum plus a group high dose psilocybin intervention. And we did that for that set of participants. We did that at around week 5 or 6 of the MBSR curriculum. We enrolled 25 participants total, and these were physicians and nurses, and many of them within our own hospital system. And then we tracked a whole range of outcomes. So depression, obviously, we looked at burnout with the Maslach burnout inventory. We looked at PTSD symptoms with the PCL-5, demoralization with the demoralization 2 scale. We looked at burnout. Yeah, I mentioned the Maslach burnout inventory. We looked at a range of experiential measures, and there's a number of different tools that get used in psychedelic trials, like the mystical experience questionnaire, the challenging experience questionnaire. We used a tool called the non-dual awareness dimensional assessment, which is a really unique tool developed out of Eric Garland's lab, who's a mindfulness researcher who had been here at the University of Utah, was an investigator on this trial as well. And we looked at that both with state and trait mindfulness. We did a lot of measures here. We looked at mindfulness outcomes again with that tool, with the Toronto Mindfulness Scale, with the 5-facet mindfulness questionnaire. We looked at a number of functional outcomes as well in terms of quality of life. We were interested in expectancy measures, which is kind of a big theme in psychedelic research. To what extent does somebody's own expectations going into an intervention like that impact outcome? And so we were interested in that. We also looked at a whole range of like qualitative data just based on people's experiences. And
Yeah,
we
and I'm really
tracked that.
glad that you're listing a lot of these different aspects to it because it's not just about are you able to count your breath by the end of the intervention? It's like, okay, you can pay attention, but so what?
Yeah,
These are some of the so whats. And having that differentiation of things like the FFMQ, what aspects of a person's experience is this impacting?
yeah,
And
exactly.
so glad to hear that that is part of this. And what were some of the things that you found as outcomes for the participants?
Yeah, I should say as well that we were looking at safety and feasibility as well, a small study. And so, one big question is this feasible to do with healthcare providers? It's a very intensive intervention. Is this safe in terms of adverse events or serious adverse events? Um, yeah, and we tracked outcomes looking at 2 weeks after the intervention as our primary outcome measure, and then we tracked out to 6 months. So 6 months after people had completed the whole intervention. And yeah, we found this was safe, so that there were no serious adverse events in the trial. We found that this was like acceptable and feasible for these like very busy, overburdened clinicians, in terms of like staying enrolled in the trial, adherence to MBSR. Um, and then we found a really large effect on both depressive symptoms and symptoms of burnout that favored the combination group, so that favored the MBSR plus group psilocybin group, which was really, really interesting. And that signal was largest at the 2 week post point. So by the 6 month mark, folks who had just done MBSR were sort of catching up to the group that also had psilocybin in terms of depression. But we found a very significant effect for reduction in depressive symptoms and reduction in burnout symptoms. Um, we found a very significant effect with demoralization that favored the psilocybin group. Um, and another tool that we used, or another scale, is the Watts Connectedness Scale, which is maybe a less widely used scale, but looks at measures of connectedness to self and to others and to the world. And yeah, again, saw a really big signal favoring the combination arm of the trial on that scale. Um, so yeah, I think on the whole, some of our questions were, is this like a useful adjunct to mindfulness training? Is this a helpful adjunct to an intervention that we already know has an evidence base in treating some of these symptoms for healthcare providers in particular?
Yeah, there are two things you brought up that I want to explore a little bit on this. One is the challenge of bringing a full program like MBSR, which is not a light commitment. It's a fairly heavyweight commitment of 2+ hours, not just class time, but then 45 minutes to an hour and a half every day for the 2 months and all that kind of stuff as well. What were some of the challenges you may have had just in being able to have that opportunity for people within a very busy healthcare profession to be able to dedicate that time to the course? And what are some of the other challenges you ran into as well?
Yeah, that's exactly right, Ted. And these are like very busy clinicians, and the MBSR curriculum was an in-person class where people had to park and then, be present for that duration of the class time, plus home practice time, which is a big part of MBSR as well. And I think one of the main challenges we had, for instance, we put out study posters, sort of advertising the study, contact this number if you're interested. And when you put out a study poster that has the word psilocybin in it, you get a lot of responses. So people are very, especially now, like with all that's happening with psychedelics in the media and Michael Pollan's book, and a lot of attention being given to that domain in particular. Geez, people really want to sign up for that. So within literally days, we had hundreds of people wanting to be part of this trial. And in large part, I think, influenced by the fact that this was a psilocybin trial. But then you randomize people, right? And half of them are not going to receive psilocybin with our study design. And so there's some level of expectation in place for something like psilocybin that might not be there for something like MBSR. Perhaps not in a justified fashion, right? But people are pretty keyed up and oriented towards, they want to receive that part of it, and they'll go along with this mindfulness business if that's the sort of route. And so that is a challenge with this kind of study design. And there were a range of things that happened, I think, in relation to that in the study, in terms of participant expectations, even some loading of disappointment for participants that were randomized to the MBSR only arm. And so that was one challenge, I think, in particular, with, as you said, like people that are dedicating a lot of time and already pretty overburdened.
Something else you mentioned was around connection, and you gave a TEDx talk. And at the very beginning of that recording, you talk about connection, and that stood out for me because in the book, There's a recent interview on Jim Jeffries' podcast with Johan Hari about his book,
Yeah.
Chasing the Scream, for those. And one of the things that he said in that interview is, and this has to do more with addiction recovery than what we're talking about with research around psilocybin and psychedelics, and we'll talk a little bit about that too. But he said the opposite of addiction is not sobriety, it's connection.
Mhm.
And so when I saw your TEDx talk, I was like, oh, and then you brought it up here. So I'm wondering if you might share just a little bit about so much of the importance of connection and how that influences how people are and the ways in which that can help us with difficulties in our lives.
Yeah. Yeah. Well, I think I like Johan Hari's work and that sort of conceptualization of suffering widely understood, but also in particular related to addiction, substance use disorders. I think there's a lot of validity to that kind of framing. And I think of that in terms of, this concept of burnout, right? What is burnout? How do we think about that category? And in fact, I was listening in preparation for this conversation, listening to an older conversation you had in October with, and I'm probably going to pronounce her name incorrectly, Barbara Doleman von Velde,
Yep.
Velde, Veldeman, or,
Yep.
and I'm sorry if I'm mispronouncing
No
it.
worries.
I
It took
just
me
thought
a bit of practice to get it right too.
I thought that was a brilliant conversation and really appreciated that framing of burnout. And I think one of the quotes I recall from that conversation was that this is really less about compassion fatigue than apathy fatigue, right? And it's easy for us to develop these ideas of burnout as related to workload or associated demoralization with these sort of objective features of the workplace demands. But so much of burnout seems to be related to this idea of connectedness, right? And connectedness to your colleagues, connectedness to patients, connection to yourself, right? And your own values, and how are you showing up with those values with your day-to-day work. So that feels so central to me, and that became just so loud in working with these providers, right? And I'm a physician. I work in healthcare. I've experienced burnout, right? I've seen this phenomenon, right? And but it was really remarkable to see how impacted so many
Yeah.
people in our system are with this, and how central that sort of very general idea of connection seems to be with so much of what's going on, and how that plays out, and how people kind of respond to those, yeah, I guess those feelings and symptoms.
Yeah, and this is why the burnout course that I have, and this is one is particularly used in healthcare, and I'm building one specialized for nurses, is the idea that burnout's not just one thing. There are several different aspects to it. It's not just the exhaustion. There are several different parts to it. And that dealing with it, some of the most effective solutions to it, it's not about becoming numb to it. It's not about withdrawing. You mentioned that with empathy or apathy fatigue. That's a thing, not compassion fatigue.
Yeah.
And that
Yeah.
the compassion, the helping someone else, you feel better when you help someone else.
Right.
Mindfulness can help us really inhabit that experience of what is it like when you make a difference.
Right.
And that correlated perfectly every single time I give this course with the results and the feedback from it.
Mm.
That what is most helpful for people experiencing, and this is specific to workplace burnout, because burnout does show up in other aspects, but focusing on the workplace, is people want challenging work. Nobody said, I want to wake up and be a couch potato and be a slacker all day. No, people want challenging work, but not overwhelming.
Right.
They want to partner with others on building complex and workable solutions to those challenging projects and work that they're doing. And the third thing is being able to see that they're making a difference.
Yeah,
All of those have to do with a underlying support theme of connection.
yeah,
So it's
exactly.
beautiful to see. Well, let's shift a little bit, shift gears. You also mentioned work with ketamine, and I wonder
Mhm.
if you could tell us a little bit about that too.
Yeah, yeah, happy to. So yeah, I do clinical work with ketamine assisted psychotherapy and so a little bit of a different model than like standard ketamine infusions. So we're using ketamine, but we're pairing that with a like a robust, personalized psychotherapeutic course, right? And we're very interested in experiential elements with ketamine, which is not always the case in terms of how that medicine is used. Um, so I'm doing some clinical work with ketamine assisted psychotherapy, and then we've run some clinical trials as well. Also combining ketamine with a mindfulness intervention. And this was a study that I completed with Eric Garland. And yeah, we're currently submitting for publication. But this was a study looking at ketamine assisted psychotherapy plus an 8-week mindfulness curriculum that Eric has developed called Mindfulness Oriented Recovery Enhancement or MORE, which is an evidence-based mindfulness training program that combines like CBT techniques as well, combines sort of elements of positive psychology and mindfulness. But we did a study where we enrolled patients with opioid use disorder on buprenorphine to either just more, just the 8-week mindfulness curriculum, or more plus 2 ketamine assisted psychotherapy sessions. And we're looking at, instances of drug use longitudinally out to 3 months, looking at changes in other mental health outcomes, changes in stress. We looked at changes in, again, mindfulness measures, both state and trait. Um, so yeah, another domain, ketamine, pretty distinct from psilocybin in terms of mechanism of action and in terms of risk profile as well. But again, like in this study, we showed that combination of ketamine plus more, we had fewer instances of drug use over the duration of the outcome interval. We showed increase in measures of mindfulness that also predicted those changes in drug use frequency, which was interesting. So I think I think overlap there for sure, and overlap with ketamine experientially in terms of what can happen for people compared to classic psychedelics. Certainly some distinctions there as well.
What I'm curious about with this area of research that you're in, how psychedelics influence how people are, and in a variety of situations, maybe mental health, it may be addiction recovery, as you work with Eric, for example, is that attitudes have been really struggling with how things were in the 60s
Yeah.
and drug use, and that has become a really heavy lift to get past that. And I'm wondering if you have any of your own thoughts or what you've observed about how this may be shifting a bit, even with an opioid epidemic that has been really problematic for research into any kind of pharmacological intervention.
Yeah. Yeah, you're right. I mean, I think after a very long hiatus and really any scientific study in the last 10, 15 years, there's just been this really dramatic resurgence of interest, a huge exponential increase in clinical trials with a range of psychedelics. I think shifting public conceptions, right? We now have decriminalization measures and legalization measures happening and continuing to develop. From the standpoint of doing research with Schedule One drugs, it's still very hard. You need FDA approval, you need a Schedule One license and the DEA on board. Historically, very hard to get these studies through your own institutional review boards, and so it's a huge uphill battle to even do any kind of clinical trial with a Schedule One drug like psilocybin or LSD or DMT, other classic psychedelics. That's changing. I mean, the NIH is now who knows how things will change with the NIH with this new administration, and buckle your seatbelts. But um, there is a sense that things are changing, and there is now at least some federally funded opportunities to do these kinds of trials, and that's very new. That has not been the case for like the last 50 years, and that's had a huge effect on just being able to accumulate science. So I think all of that is changing. I think changing in the right direction to be able to re-examine these compounds, which had a very robust history in the history of psychiatry back in the 1950s and through the early part of the 1960s, and which have been, yeah, I think marginalized in certain ways that have not made sense for that class of chemicals. All that being said, like the notion of hype with psychedelics too is a very real thing, and I think it's important to be thoughtful about risks and who this is safe for and appropriate for, and to maybe not overpromise on what is still pretty early on in terms of at least for certain chemicals, like still fairly early stage science. So I think still a work in progress, but yeah, definitely a sense of like a lot of forward momentum in looking at psychedelic assisted therapies.
Yeah, and that hype is also something we see with mindfulness.
Sure.
This
Yeah.
is not a cure-all, and it
Yeah.
is in many ways simple, but not always easy.
Right.
And we have a lot of work to do. The scientific study of it is relatively young, only about
Right.
4 decades, and that
Yeah.
may seem like a long time, depending on your age, but it's really quite short in
Yeah.
terms of research. I want to wrap up, Ben, if we could, on just what you might suggest to people who are curious about this. I'm, of course, going to have links to your work and some other pieces in there for people, but for those who are interested in this kind of research or are wondering and may have particular attitudes about psychedelics, what are some things that you might just give them to chew on after this?
Yeah. And in terms of resources or like just general perceptions or, yeah.
Any of the above, yeah, whatever fits.
Yeah. Well, I guess it depends in part on, I imagine a lot of your audience is very well versed and familiar with mindfulness and probably coming from that background. And I think there's a wide range of opinions on the role of psychedelics as it relates to Buddhism or contemplative practice or meditation. And I think there can be a real sense that perhaps psychedelics are either just a sort of intoxicant, right? That would, be a distraction or just sort of a route towards more delusion in certain ways. And it's not to say that is absolutely maybe not the case, but I think there can also be hesitations around like shortcuts to the top of the mountain, right? That what okay, so you get there, what are you going to do about that? And how do you have a sustained practice? And so I would imagine a lot of listener hesitations might be related to that. And I think there would be room to push on that a little bit, right? And that might be like a useful message in terms of many things we don't know. We don't really know the potential role of psychedelics here. We don't know all of the liabilities, and there certainly would be some, both from a medical or safety standpoint, but also liabilities related to like our desired outcomes and striving and sort of goal-oriented approaches. It might not dovetail with other aspects of mindfulness practice. I guess I would just encourage people to maybe like um, educate themselves or be open-minded in seeing what the science might show in terms of could this be useful for people, and what would those roles be in terms of facilitating or synergizing mindfulness practice. So maybe that's a fair message to give for your audience.
Yeah, I think it's very well said. This whole idea about intoxicants that cause heedlessness seems to be used as a, okay, that's a stamp, and anything at all that has any sort of influence on perceptions is therefore bad and fits into that bucket. And my pushback on that has more lately been, well, what if a particular substance that we've looked at in a certain way can actually promote heedfulness long term? What would that be like? And
Yeah.
can we explore what that is? Because we don't know yet.
Yeah, that's a great summation.
Yeah. Well, our guest today, Ben Lewis, I really appreciate you being here today. And for those listening, again, I will have links to Ben's work along with a few other things where links are found. Ben, thank you so much for being here. Been wonderful speaking with you.
Well, Ted, thank you so much. Yeah, real pleasure to talk to you, and thanks for the opportunity.
Thank you so much for tuning in today. And as always, I'm so grateful to see you here. Do be sure to like and subscribe if this is interesting to you and you want others to find these podcasts and maybe get some benefit from it as well. And remember, every moment you have a choice. Just make it the best you can. And I'll see you next time.